Hi, I'm Dr. Heimlich, and I want to share with you some shocking news about fibromyalgia. Are you ready? Fibromyalgia is not a muscle problem. It's a neurological problem. And I know you've been told it's a muscle problem, but it's not. How do I know? Well, number one, there's been thousands of research papers done over the last 10 years that simply show the following. The brains of people with fibromyalgia simply don't work the same way as those who don't. And number two, I've helped out so many people over the last years using the techniques and information that I'm going to share with you today. We've helped them with the pain they thought that they were going to have to live with forever. So why isn't that common knowledge? Why isn't it common knowledge that fibromyalgia is a neurological problem? Well, because of two very important reasons. Number one, there's still a real stigma about people who have chronic unexplained pain. It's actually easier to blame it on you. Say, maybe you're just depressed. Maybe you need to take some antidepressants, and maybe that's why you're hurting. Well, it's ignorance, frankly, because there's simply a whole huge body of information that tells us the brain is responsible for all the symptoms that you've been feeling. The second reason, there's no medication for it. I know you've been given medications such as antidepressants and others, various concoction potions. But the fact is there's no medication for the cause, the neurological cause of fibromyalgia. Now that brings me to my philosophy. I probably should get off my soapbox, but a little bit I'm going to get right back on it because I think it's that important. I want to treat you, not your diagnosis. I want to treat what we find in you, not the label you've been given, because let's face it, many people are misdiagnosed, right? Everything from strep throat to cancer. And it really doesn't tell you what to do about just saying you have fibromyalgia. Sure, it gives everybody an idea about what's going on, but what are you really going to do to help you get better? The first thing you have to understand is the neurological cause of fibromyalgia. We're going to start with that neurological cause, and it's pretty much this. It's called an overactive midbrain. The midbrain's an incredibly important area of the body, and I realize it's stuff you've probably never heard before, and that's okay. It's going to change the way you look at the pain that you've been in. It's going to give you some solutions to help you end it. Now that midbrain is responsible for all these symptoms you've been having. So what normally happens in the human body, you've got that midbrain, and you've got a lower brainstem, blood, and then you've got your cortex, which is above it. And the cortex and lower brainstem, normally what they do is they dampen that midbrain. And that midbrain, it needs a lot of supervision. The midbrain's where you process light, sound. It's where your sympathetic nervous system starts. And here's what goes wrong. When those other areas aren't dampening that midbrain, it gets hyperactive. It gets too excitable, it gets irritable. And that's why you can get problems with blurry vision. Even light and sound can bother you. You can get headaches. These areas have connections that go down into your gut and into your intestines. And when it's overworking, and overfired, you can get constipation. You can also get diarrhea. It can make your adrenal glands work 1,000 times too hard. And that cortisol, it goes up to the brain and affects the areas responsible for memory, fibro fog. And I know you've experienced these symptoms before that we're talking about, but I'll tell you this, probably no one's explained them like I just did. And that's why you feel so terrible. Now, how do we find out what the reason is for your fibromyalgia? Well, we've got a whole huge test of inventive tools that we can use to analyze where the dysfunction is in your system. And I know these things look strange, but the results speak for themselves. People that thought they were going to have to be debilitated the rest of their lives, they're able to get their life back by these weird little tools that you see here. So once we find out where the problem is, what we do is we treat it. And I don't want to overwhelm you because there's literally hundreds of things that we can use successfully with people like you. Here's the bottom line. I don't want you to hurt another day. There's really no reason for you to be sitting there playing Russian roulette with a bunch of medications. Bottom line is this. You need to find someone that understands that fibromyalgia is a neurological problem, not a psychiatric problem. Yeah, the problem's in your head of sorts, okay, but it's not the way that someone's told you before. It's real. What you're feeling is real, and there's a reason for it. You gotta find someone that understands, so that way you can get the appropriate treatment. And to find someone who can sit down and listen to every single word that you say is, because I know you've been there. You've been there to the doctors, they don't even look you in the eye. They let you talk for 2 or 3 minutes, they write you a script, and then you leave. You need to find someone that won't do that. Because someone trained in this information knows how important, how crucially important it is, every single word that you say is. I mean, to understanding the cause of your problem. I want to treat the cause of the problem, not just the symptoms. So what you need to do is find someone that'll listen to you, that understands that this is a neurological problem, and can help you end your pain today. Below, we've got a box if you'd like some more information and a fantastic informational DVD that expands on what we've just talked about. Please fill that out or give us our office a call. Thank you for listening.